First of all, thank you so much for accepting my invitation. You are not a random doctor. You are, well, maybe instead of telling people who you are, maybe you can just simply introduce yourself.
Well, thanks for having me on the program. I'm Dr. Peter McCullough. I'm an internist, cardiologist, and a trained epidemiologist. I'm in academic clinical practice in Dallas, Texas, United States. And I see patients about half the time and cover hospital duties. And then the other half, I'm involved in scholarship as an author and editor and a investigator. And most recently, in the last 2 years, I've become a media commentator on COVID-19 to basically help guide the United States and countries around the world in terms of the pandemic response.
Well, I'm asking you because, as you know, the system is trying to undermine your credibility. I checked many facts on Google about you. I know the story. I'm with you. So that's why it's so important to tell people who you are. And that's why I'm asking. Can you tell us a little bit more about the publications and about the number of publications?
Yeah, so I've been focused on heart-kidney connections throughout my career, and I've had certainly grant-funded large research projects. And I've worked across clinical trials as a principal investigator, steering committees, various adjudication or data safety monitoring boards. But also I've worked in epidemiologic analyses as well. And so I have over 650 publications in the peer-reviewed literature in the National Library of Medicine, PubMed. My rating in terms of my H-index is high. And I've published in the best journals, New England Journal of Medicine, Lancet, JAMA. And COVID-19, I have over 50 peer-reviewed publications, and including the seminal publications outlining how COVID-19 can be treated early as an outpatient to prevent hospitalization and death. So I'm very experienced as an editor and investigator. I've looked at a lot of data, and I don't think fact checkers will have really anything to fact check, because I've been very careful to cite the data as I always do in my clinical practice and in my research practice.
Okay, this is so important because as far as I know, you and Dr. Malone, you became the public enemy. Now, how do you think why?
No one's ever directly confronted me on anything. No one's even really dared to have a conversation. I think they know that both myself and Dr. Malone have the truth, that we are seeking the truth, and the views that we've taken are closest to the truth. Those that are farther away from the truth, they really don't have any type of standing. So I've never, never had a situation where someone said, well, they want to support a position of therapeutic nihilism for early treatment, or they want to support a position of mass vaccination. It just never happened.
The system is trying to destroy you because you are saying that instead of waiting 2 weeks until somebody is so ill that you need to treat the person in the hospital, you are saying that I mean doctors should treat patients. So there's no need to wait 2 weeks until you will start to treat people, right? Do I understand well?
Yeah, that's true. And the patients strongly support my position, and so do the published studies. Now, we act on the precautionary principle, meaning that this is a mass casualty event. We can't wait for large randomized trials or wait for guidelines that depend on large randomized trials, because those are many years away. We have to take action now with drugs that show a signal of benefit and acceptable safety. And that's what we do. And when we have randomized trials, that's wonderful. But when we don't, we use other sources of data to arrive at our protocols. Our protocols we've been using now for 2 years. So patients want early treatment at home, and those who try to block early treatment or argue against it don't have any standing.
I saw your testimonial which you gave to the Senate in the United States. That was last year or 2 years ago?
In November of 2020.
2020. So that was 1.5 years ago. You said something that there is a lack of compassion instead of treating COVID. Can you tell us more about this?
I've said that we've evolved into a crisis of compassion. I've always treated all my high-risk patients. I've tried to respond to every single call, getting patients the medications they need to avoid hospitalization and death. But not all doctors have acted honorably as I have. And so we really have fallen into a crisis of compassion. Many doctors have told patients that there's no treatment for COVID-19. And many doctors have actually denied treatment to COVID-19. In fact, there are pharmacy boards and medical associations like the American Medical Association that have specifically taken a view that they want to deny early treatment to patients. That's what's called therapeutic nihilism. It's fundamentally wrong. It's creating injury, it's creating fear, suffering. It's driving hospitalization and death. And it does basically result in a crisis of compassion, and patients know it.
Okay, you're a very experienced doctor, and there are many young doctors who maybe they don't agree with the system, but they are at the same time the part of the system. So what is the message from the doctor with so strong experience to them? If they're afraid to treat, you know how the system works. If you treat people and if there is some like deaths, so people can sue them, so they are maybe afraid, so it's easier for them to go along with the system. So what is a message from the doctor like you to young doctors if you think we can treat or we know how to treat people with COVID-19?
There's a difference between being a very intelligent young doctor and then being a doctor who has a strong mind. I think those doctors who have strong minds understand that early treatment is fundamental to treating any fatal infection. And so what I encourage those young, intelligent doctors to do is strengthen their minds. They need to have a much stronger grip on a terribly important issue, which is the Hippocratic Oath and their fundamental commitment to helping patients. And that should reign supreme. It should reign supreme over fear, any threats of retribution. They should be absolutely the champions for their patients, and when they're not, they're letting their patients down.
Okay, just to clarify, in Poland we have small associations of doctors, lawyers, soldiers who are trying to fight against the system, but it's really difficult because every time if there is a doctor in Poland who is trying to fight against the system, there is a bigger association who is just trying to destroy these doctors, or like mark them as a fake whatever, in like they are trying to undermine the credibility of these doctors. Can you tell us a little bit more from your experience about treating people from the moment that they are aware that there is something wrong, like they cough or they have a high fever?
In a recent paper with the first author, Fazio and colleagues, we examined this issue of what is early treatment. It was published in the Medical Monitor. And we found a golden time period was the first 3 days, that if we could get treatment started in the first 3 days, and just simple things, drugs to reduce viral replication, and then forms of anti-inflammatories, and then ultimately antiplatelet and anticoagulants in a sequenced manner. If we can get started in the first 3 days, there's a giant difference in terms of risk of hospitalization and death. And it's only applied to our high-risk seniors. So no doctor should feel overwhelmed with this simple concept. They would do the same thing for pneumococcal pneumonia or any other form of pneumonia. It's no different.
Professor, please accept my warm words from Poland. We really appreciate the God that professors like you exist, and thank you for everything you are doing. I know how it's difficult, so the question is not the medical question. Now it's about being a human. How do you deal with the hate, which is probably also hitting you from the system?
I've never had anybody directly try to deliver a hateful message or even engage in a conversation. So I'm happy to discuss information fairly with individuals. I'm happy to go over clinical trials. I'm happy to help other doctors elevate their game and develop strength in their convictions towards treating patients. And I welcome them into my circles.
Do you feel the support from the society, from free people?
Yes, there is overwhelming support from the public, and there's no doubt about it. The public is not happy with doctors and hospitals denying treatment, and they're not happy with being hospitalized late in the course of care. So it's clear the public wants early treatment.
Okay, in the last year, you've lost more friends or you got more friends?
I've gained a lot more. Thanks.
Okay, so you have the feeling that you are doing great, and this is exactly what I also feel and think. Let me come back to the moment where you testified to Texas Senate committee. That was 1 year ago or something like this. Can you tell us a little bit more about this, because that it can build your credibility and show us that you are really important in the United States?
I testified in the Texas Senate on March 10th, 2021, and the Division of Health and Human Services. And I told them that early treatment is associated with 85% reductions in hospitalizations and deaths. I estimated that 85% of the losses of life could have been prevented. And I charged them with getting information on the availability of monoclonal antibodies and other drugs that can be used in sequence to treat COVID-19. I really charged them with a lack of a duty, that they had not fulfilled their duty as a health and human services committee. They had been focusing on masks or hand sanitizers or vaccines. None of those treat sick patients. Sick patients want treatment. They don't want to hear about vaccines, masks, or other ineffective strategies.
So as a professor, as a doctor with your strong experience, what would you say, what is more important, to be vaccinated or to be treated properly from the first days of the illness?
It's far more important to be treated properly on the first day, because both the vaccinated and unvaccinated still get sick with COVID-19. Certainly through the Delta outbreak, we had papers one from the United States by Young Ju published in JAMA showing with Delta, the vaccines only had about a 20% vaccine efficacy. So it's a very minimal effect on Delta. Now with Omicron, we have 2 papers suggesting basically zero effect on Omicron. So the vaccines are not effective enough to promote as an approach at this point in time. The virus is mutated sufficiently where the vaccines are obsolete. So it's far more important to get early treatment.
Okay, can you tell us more about this early treatment? Because in Poland, if you are sick, they keep you locked at home, literally. They don't take you to the hospital. As long as you are well, you can stay at home. But if there is something bad going on with your health, then you need to go to the hospital, which usually is too late for you. So can you tell us a little bit more about this early treatment? Because this is something which is not popular. This is not a popular subject in Poland. Like, in my country, it looks like if you are sick, stay at home. If you are badly sick, welcome to the hospital. So can you tell us more about this early treatment?
The most important early treatment is actually to do oral and nasal washes with povidone iodine. Povidone iodine or hydrogen peroxide, povidone iodine mixed in a 10-to-1 solution or less than 1%, and then hydrogen peroxide in a 1-to-3 solution. And either using a nasal spray bottle or a nebulizer to actually sniff it up into the nose and then spit it out and then gargle with it. Up to 4 times a day in acute illness, that reduces the viral load dramatically. In a randomized trial by Chowdhury, it had a large impact on reducing hospitalization and death. So every household in Poland should have povidone iodine or betadine solution and be ready to use it as a nasal and oral rinse. It can be used preventively on a daily basis to prevent acquisition of COVID-19. And in the 12 randomized trials, it has a strong impact, over 70% improvement when this is done. So this is a simple measure. Beyond that, at home, everyone should have nutraceuticals or supplements, zinc 50 milligrams a day, vitamin D3, 5,000 international units a day, prevention 20,000 a day for active treatment, vitamin C, just active treatment, 3,000 milligrams a day, quercetin, 500 milligrams a day, baseline, and then 500 milligrams twice a day for treatment. And then famotidine. Famotidine is an anti-acid and histamine available over the counter, 80 milligrams a day. So everybody in Poland should have 6 things in a treatment kit. They should have A virucidal oral nasal wash, and a very simple, affordable, is povidone iodine, zinc, vitamin D, vitamin C, quercetin, and famotidine. Those 6 things can help so many people get through COVID-19, particularly Omicron, where we usually don't need any more treatment than that. But in a high-risk senior, those with heart and lung disease, we do use oral antivirals. We have hydroxychloroquine supported by over 300 studies, ivermectin supported by over 60 studies, favipiravir used in other countries supported by a handful of studies. And now we have a new Pfizer drug, which is a combination kinase like 3 inhibitor plus ritonavir, or the new Merck drug, which is molnupiravir. So we have oral antivirals. We use doxycycline or zithromycin to control and cover for other atypical organisms. And then we use inhaled budesonide. Budesonide is associated with over 80% reduction in hospitalization in the STOIC trial. We use oral corticosteroids such as prednisolone on day 5 or pulmonary symptoms. And then we use colchicine all the way throughout based on the Corona trial. That's an anti-inflammatory. We're down to, after that, just anticoagulants and aspirin, 325 milligrams a day. Some countries like Italy use 700 milligrams a day. And then our very high risk immobile patients, we go ahead and use full dose anticoagulants. So what I've described is called sequence multi-drug therapy for COVID-19. It takes about 4 to 6 drugs, and a doctor can organize this early and help patients get through the crisis. In high-risk seniors, there's about an 85% reduction in hospitalization and death, and shown in papers with fair comparator groups by Proctor, Zelenko, and Riault in France.
I'm surprised because in my country, many doctors keep saying that treating COVID is not possible. So are you feeling alone in the United States, or there is an association or the group or foundation, or like are you alone, or there are more doctors, brave doctors, professors like you?
I'm definitely not alone. The Association of American Physicians and Surgeons has had a home treatment guide based on these principles for 18 months, and they strongly support early treatment. They keep a list of doctors in the United States who do practice early treatment. The Truth for Health Foundation, American Frontline Doctors also support these principles. And then the Frontline Critical Care Consortium, they have slightly different but same principles. They also strongly support early treatment. We have 4 national telemedicine services. We've got 15 regional services. So in the United States, we clearly have a commitment to early treatment.
Okay, talking about numbers, how many patients have you treated, or how many people have you helped in the last year in terms of COVID-19?
Personally, I've treated over 200 patients, and I've advised on thousands of patients. It's hard to keep track. In the last Omicron outbreak, I've literally had dozens and dozens of patients call in or come into the it's like a head cold. It just just needs actually some pretty simple treatment, and for most individuals it's so mild there is fundamentally a negligible risk of hospitalization and death.
Professor, are you ready for a tough question?
I am.
Okay, who is behind the scene?
I can't tell you. People ask me that all the time. I don't have any inside knowledge, but there clearly are forces at work that are trying to deny early treatment to individuals, trying to produce as much suffering, hospitalization, and death in order to promote the vaccine and then promote continued injections of the vaccines. None of the vaccines are sufficiently safe or effective to support at this point in time, but there clearly are forces at work, and they seem to have no signs of stopping at this point in time, and they're going to simply try to do everything possible to continue to force the vaccines on the population, which doesn't want them.
Okay, generally, as a professor, as a doctor, and I'm not, well, that will be an honest question. Are you supporting, or you are saying it's not necessary to be vaccinated? If you are supporting or declining against COVID-19, everybody should be vaccinated, or everybody should be not vaccinated? What is your position, and what is your comment on that as a doctor?
The vaccines have clearly made the pandemic worse, and a paper by Subramanian and colleagues clearly show that. that mass vaccination is prolonging the pandemic, and it's driving the emergence of hyperdominant mutant strains in these large outbreaks. We have more cases now of COVID-19 than we've ever had before the mass vaccination program. So on a population basis, the mass vaccination program has failed. Our CDC director came out last summer and told Americans that the CDC does not stop transmission. And there's multiple studies, Fair and Hope, Venkatakrishnan, Chow, many of them showing there's no difference or no basically benefit of stopping transmission. A paper by Singarajan in Lancet showed that 39% of all transmission is fully vaccinated to fully vaccinated. And now we have data that's come in from a variety of sources, one from Zheng Yu published in JAMA, showing with Delta, there was only about a 20% estimated vaccine efficacy. And that's with very, very biased data towards the vaccine. With Omicron now, we have 2 credible studies showing effectively no coverage whatsoever. So at this point in time, there are no supportive data suggesting that vaccines have any benefit in the current part of the outbreak.
If there are doctors or people who would like to learn more and use your wisdom, is there a website or a place in the internet which people can visit and read something or see the videos? Is there a place?
For physicians, I recommend the Association of American Physicians and Surgeons. They keep a library of all the teaching videos and the certified continuing medical education presentations on early treatment. For the public, I recommend America Out Loud Talk Radio, the McCullough Report. I do a weekly report to the country on the COVID-19 pandemic cited, and I have nice fun sections to the program, including music and others. And I invite doctors, nurses, others in the field. And then for public health advocacy, I suggest the Truth for Health Foundation, truthforhealth.org. I'm the volunteer chief medical advisor for that organization. So there's a lot of advocacy for early treatment and information out there on vaccine safety and efficacy. We think at this point in time, the vaccine mandate should be dropped. The vaccine program should be paused until we can get safer vaccines in. And we should treat patients if they get sick. And that's the way out of the pandemic.
So you are still fighting?
Well, yeah, I'm just, I can only give my advice, and but it is taken at very high levels in the United States. I was on national TV last night. I'm frequently on national TV giving my advice to Americans almost on a weekly basis.
Professor Peter McCullough, that was a real pleasure to have you on my channel. That was a real, absolutely honor. I wish you all the best. Thank you for accepting my invitation. And with people like you, the world will become much better. So thank you so much, Professor, and have a good day.
Thank you.
Okay, thank you. Bye-bye.
Bye-bye.